Good day. So for today's discussion of understanding the self, we would be talking about the sexual self. So the learning outcomes for today's discussion would be to differentiate sex, gender, and sexuality. Next would be to identify different perspectives on femininity and masculinity. Third would be to identify types of human relations. And fourth would be to identify the male and female reproductive organs. And lastly, discuss the triangular theory of love. So what is a sexual self? So first, we would tackle the sociological perspective of gender. No? So what is the difference about when we say sex versus gender versus sexuality? So these are three terms that are commonly misunderstood. Sometimes they are used interchangeably, but there's a difference between these three terms. No? And hopefully by the end of this discussion, you would have a better understanding of what sex is, what gender is, and what sexuality is, their differences. So when we say sex, this would refer to the biological distinction set by society by assigning humans as male or female in terms of genitals, so chromosomes or physical or hormonal attributes. So basically, when we talk about sex, no, this would be pertaining to the attributes that you possess, whether you're male or female, or sometimes we refer to as intersex. So this depends on the genitals or chromosomes that you have. So sex would be seen into the physical or to the physiological appearance of the person, whether that person has that particular chromosome or particular genitals. Now, some misconceptions about sex. It is given before the baby is born. Second is that sex is determined by anatomy. Third is that it is defined by reproductive purposes. Fourth is that sex is seen as something that's absolute. And five is that it would be unnatural to veer away from predetermined anatomy and reproductive functions. So all of these are seen as misconceptions about sex. Okay, so the following are based on the set of standards set by society. Often we would have these misconceptions about what sex is. No? Sometimes we see them as something that's absolute, but again, these are seen as misconceptions about sex. Now, when we talk about gender, this would not be dependent on the biological attributes in contrast with sex, because a while ago we defined sex as those pertaining to the biological attributes, whether that attribute is present or not within you. So that would determine whether you're male or female depending on the genitals and chromosomes and other attributes that you possess. But when we talk about gender, this is not dependent on biological attributes, no? But also factors in how a person perceives his or her identity. So this is based on how the person identifies himself or herself. So the concept of gender preference arises because it takes into account norms, activities, rules, or attitudes that account for an individual's perception about his or her gender. So this would be based on how that person identifies himself, herself, or themselves. This is not based whether that person has a particular genitalia or not. Now we have different types, no, or different ways of how people identify themselves. First is what we call cisgender, meaning that person's gender identity is aligned with the biological body or the sex of the person. So this is how we usually refer to people as straight. No? Other term would be cisgender. So these are people whose biological body is aligned with the gender identity. So when they say that they identify as male, their physiological appearance would also be male. They possess certain attributes that are associated with the male sex. Transgender, on the other hand, would be the biological attributes of a person do not match his, her, or their perception of the view of that person. Okay, so if that person identifies as the opposite gender, wherein his or her sex is not matched with that gender, we call that person as transgender. So for example, if a male identifies as a female. Now, gender queer these people are gender fluid. When we say gender fluid, they do not align themselves with just one or the other gender. They do not simply identify as either male or female. Okay, because they do not identify with a particular gender or sexual assignment. That's why we call them fluid. They don't identify with just one. Gender queer or queer for queer simply means that that person does not conform with the societal standards or what is demanded by society. That's the meaning of queer. Moving forward to sexuality. This refers to experiences, attraction, practices, and identity that describe sexual attraction. So sexuality can be heterosexual, lesbian, gay, bisexual, queer, etc. So this is somehow similar with your orientation, who you are attracted to. When we say hetero, okay, this means the opposite. So it means that you're attracted to your opposite gender or to your opposite sex. That's why when you say homo or homos, which means same, you're attracted to the same sex or to the same gender. Also lesbian, when two females are attracted to each other. Gay would be the common term to encompass. Bisexual, meaning you're attracted to both genders, and queer, etc. So a while ago we discussed about queer already. You're not conforming to the standards or societal standards. Okay. So just to further emphasize, when we say sex, this would be your biological traits that society associates with being male or female. So there would be certain attributes that would determine whether you're male or female. Gender, on the other hand, would not be dependent on these attributes, but rather gender would be your cultural meanings attached to being masculine and feminine, which influences personal identities. So example would be man, woman, transgender, intersex, genderqueer, among others. So this would be reflected on how you identify with a particular gender. Whether you would cross-dress, whether you identify as a male or as a female. That's what we mean when we talk about gender. Sexuality would be your sexual attractions, practices, and identity which may or may not align with sex and gender. So for example, you might be biologically male, but you're attracted to male also, no? So that would be homosexual, no? You're attracted to the same gender or same sex. Heterosexual, you're attracted to the opposite sex. Bisexual, you're attracted to both genders or to both sexualities. So yeah, when you say queer, this would be not conforming to the societal standards or to what's considered by what is normal with regards to social norms. So we have genderqueer, non-binary, meaning these people do not conform to just male or female. Gender neutral, wherein they don't identify as either male or female. So these are just some, to name a few. Transgender, you're called a trans man if you transition to a man. You were previously biologically female, but then you transition to or you identified as a male. So there's a difference pala when it comes to transgender and transsex. When you say transgender, you simply identify. But when you're called transsexual, you transitioned already, meaning you already had surgery, the manner of how you clothe yourself. So transgender meaning you're just simply identifying with the opposite sex or with the opposite gender. Transsexual meaning you've already transitioned. So intersex. A while ago, we talked about sex wherein you would possess certain attributes that would characterize you as male or female. However, there are people who are born with both genitalia or genitals, wherein they would have the male and female organs. While others, they don't have any. They're not born with any genital organs. So we refer to them as intersex. When we say intersex people, these are people who are born with any of the several variations in sex characteristics, including chromosomes, gonads, sex hormones, or genitals. that according to the UN Office of the High Commissioner of Human Rights do not fit the typical definition for male or female bodies. Okay, so highlight that, no, do not fit the typical definition of male or female bodies. Why? Because when we say a male body, that person would have the penis as his genitalia, no, or genitals, while for the female body, they would have their vagina, ovary, and so on. Intersex people might have both, no, as I've mentioned earlier, or none at all. So that's why we call them intersex. They do not fall between the two categories. They do not have both. They don't have either, or sometimes they have both. Now, pertaining to human relations, one would be sensuality. So this is different from sexuality. So let's not confuse it. No? When we say sensuality, this is acceptance of your own body and the capacity to experience gratification. Sensuality, a while ago, or last week, we talked about the senses. No? We have 5 senses: the eyes, the ears, no, for sight, no, we use the eyes. For the ears, we utilize or we have our auditory system, no. For touch, we have somatosensory, or utilize our skin, no. For gustatory, we have our tongue, no, for taste. And for olfactory, we have our nose, no. We utilize our nose to smell. Sensuality comes from sense, no. So when you are able to appreciate your own body, when you are able to experience gratification through your own body, through the use of your senses. So for you to be able to experience gratification, no, for you to be sensual, you have to have knowledge of the anatomy and physiology. Simply put, you need to know your own body. We also need to understand our sexual responses and body image. No? Let's start with the last one. When you say body image, you're able to see yourself positively. You're able to see your own body positively. You don't look at yourself lowly or pangit or whatnot, meaning you have a positive body image. Second would be understanding your sexual responses, okay? And the third would be knowledge of anatomy and physiology. Combine these two, no, we have what we call erogenous zones. When we say erogenous zones, this would be areas of our body that we are able to experience gratifications sensually. So we might think that our genitalia or our penis or our vagina would be the only erogenous zones. No? But in contrast, we have other parts of our body that could experience gratifications. That's why when we touch other people, just through their skin, no, we're able to, some of us would be aroused. Your nipples would also be your erogenous zones. Some would be the mouth, no? So your erogenous zones are not just limited to your sexual organs, but rather throughout your body, you would have different erogenous zones wherein you'd be able to feel arousal or sexual gratification. Intimacy. So when we say intimacy, this would be your close ties, a feeling of familiarity to a person, individual, which may evoke the following feelings, such as caring, sharing, risk-taking, vulnerability, and self-disclosure. When you have intimacy, or when you say that you're intimate with a person, it means that you're comfortable sharing to that person who you really are. That's why we say vulnerability is present, because you're not wearing any masks. You're not pretending to be someone else, but rather you're showing that person who you really are. That's what intimacy means. No? That's why when making sex, some people refer to it as being intimate with each other. Why? Because you're being vulnerable to that person. You're showing that person your naked body or your whole self. No? You're taking the risk. You're showing your vulnerability. There's self-disclosure. So that's what we mean when we say intimacy. Next would be your sexual identity. No? This refers to an individual's gender roles orientation, self-esteem and confidence levels, relationships with family and friends, perceptions of self as male or female. That's why sometimes we would have this bias towards work. Like for example, firemen, no, this job is seen as something that only men can do. No, but in reality, we're trying to break that stigma already. No, we're trying to break the barrier that there are jobs that are only particular to male and that there are jobs that are only particular to female. So that's what we mean when we mean gender roles. Like for example, being a housewife, no? We often attribute that to only for females, but right now there would be house husbands. No? This would be husbands who are stay at home taking care of the family, no? While the woman is the one who's working. Okay. Fourth would be our human reproduction. So sexual reproduction through sexual intercourse of a male and female individual. Although with the advancement of science and technology, human reproduction is now possible through in vitro fertilization or having a surrogate mother. So in order for us to reproduce, first we must be able to have sex, wherein the sperm would be fertilizing the egg of the female. But with the advancement of technology, we now have the in vitro fertilization. Now, when we say in vitro fertilization, this is when conception is done in a laboratory. No? This is very helpful for couples who are having a difficult time making a baby. No, wherein sometimes it's something's wrong with the female. No, wherein the womb of the mother is not able to hold, no, the egg or the fertilizing egg. No, that's why that person might often have miscarriage. Sometimes naman when the mother is already too old to carry or to be pregnant, we would have what we call a surrogate mother, wherein the egg of the mother and the sperm of the father would be fertilized in a surrogate mother, meaning another person. So another person would be carrying the baby for the couple, but the surrogate mother doesn't have or doesn't utilize his or her eggs rather. Okay, it's the eggs of and the sperm of the couple. It's just that the surrogate mother would be the one carrying the baby for them. Next. So the use of birth control and contraceptives has also been an option for some people who do not want to conceive yet. Certain issues surrounding reproduction are the following: contraception and fertility issues, lifestyle, STDs, anatomy and physiology, and morality issues. Okay, so using birth control could be part of your family planning. There are couples, no, who do not want to be pregnant or who do not want to have a baby yet. That's why they do family planning. For others who cannot abstain, no, or cannot what do you call this, do not use withdrawal methods, they have contraceptive methods or other contraceptives that they could use. Often we would have often the most used would be your condoms. For some women, they would take pills. No? Now, there are some issues regarding the use of contraceptions or contraceptives. First is that in terms of fertility issues, no? For women who use birth control pills, some of them would have side effects like when they want to have a baby, they would have fertility issues, no? Because of the prolonged use of these birth controls. No? It affects their hormones, and later on in life, when they want to have a baby, they might have difficulty conceiving. To others naman, in terms of its effectivity, no? There's no 100% guarantee that that contraceptive would be effective. No? Even condoms, there would be some mishappenings that even if that person you used a condom, the couple could still get pregnant. Other issues would be lifestyles, STDs. Although studies shown that condoms have been an effective way, to protect yourself from STDs. And obviously, there will be morality issues when it comes to use of contraceptives, no? But let's not dwell on that. Next would be your sexualization versus objectification. So there's a difference between the two. When we say objectification, this is viewing a person as a sexual object for own pleasure, wherein you disregard the person's feelings or emotions. You see the person as a sexual object, a means for you to experience gratification. That's what we mean objectification. You're only seeing the person for sexual purposes, for your sexual gratification. Sexualization, on the other hand, is when you view the person who is not naturally sexual, but seeing it as such. No? So you see the person, even if that person is not trying to be sexy, even if that person is just a normal person walking by, you sexualize the person. You see that person sexually, even if the person is not trying to be sexual. So, what are some examples of sexualization? No? So sexualization may be in the form of the following. First would be styles of dress. For example, women who are wearing a two-piece bathing suit is sexualized than women who wear a one-piece bathing suit. Why? It's because of the visible skin. No? So even if that person is wearing whatever, sometimes they would still be sexualized. Actually, even if it's one piece, two piece, or even if the person is still clothed, well, some people would still sexualize them, which is wrong. No, we shouldn't view them as sexual objects. Second would be appearance and body language, especially for women at work. Besides how they clothes, beside how they clothe themselves, sometimes they would be sexualized simply because of how they move. Like for example, pagtutungo ka when you try to pick up something that's on the floor, they see it as a sexual move, Pagtutungo ka, for some women who are blessed with big breasts, yun yung tinitingnan ng ibang tao. So even if that act of picking up an object from the floor, they see it as someone who's something that's sexual, yung pagtungo kasi tumalabas yung puwet or nakikita yung cleavage. In terms of advertising, whether it's not just in advertising but in movies, in televisions, wherein it's okay to see the man's nipples, but for women it's not okay, because it's being sexualized. So girls' nipples would not be shown in commercials, but it's okay for men to show their nipples or to be shirtless when it comes to televisions or advertisements, etc. Yeah. So aside from advertisement, we also have movies, talk shows, and media. So for example, belly dancing is viewed as a sensual dance, and people tend to disregard the technique and history behind it. So belly dancing, particularly in India, has a very long history. It's an art form for them. But how we see it, we sexualize it. We see it as something that is a means to seduce. We forget the history of belly dancing, and we just see it for how we just see it sexually, seductively, like a form of stripping. We disregard the history of belly dancing and just see it as something that's a sexual act for our sexual call this gratification. Now, there would be some problems, because of sexualization. Obviously, there would be harassment and sexual assaults. For offices, sometimes women would have unwanted attention towards them. Yung paghihipo, catcalling. So these would be your harassment and sexual assaults. Often, or most of the time, these people are not calling for this. They do not want this type of attention. It's just that some people would see them as sexual objects, or they sexualize the person, even if that person does not really want that attention. Okay, that is considered as harassment and sexual assault. Okay. Now, moving forward to the female reproductive system, I hope that you whether you're male or female, are familiar with your own reproductive system. No? If lalaki ka or if babae ka, I hope that you are familiar with your body. Okay. So for the female reproductive system, we have the uterus, the vagina. So these are the parts, no, of your female reproductive system. So just a quick discussion with regards to the female reproductive system. So this, the uterus would be where your eggs would be we call this conceived. So women bleed because of the blood lining or the blood lining through the uterus. So your eggs travels from your ovary to your fallopian tube down to your uterus, wherein it would stay there. No? And the lining, or there would be blood lining the uterus in order to cradle the egg. But once the egg is not fertilized, no, wherein if there's no sperm that fertilizes the egg, no, the uterus would shed the blood. That's why women bleed. No, women would have their what do you call this, mens or menstruation. Okay. Next would be your male reproductive system, no, your penis or your gonads, no. So yung balls, that's what we call the testes. Okay, just for, do we have a male student? Okay. For males, you'd notice that your eggs are not aligned with each other. No? Hindi sila pantay. The purpose of that is so that there would be no friction between those two testes or between your testes. Okay? Now, let's talk about the sexual responses in humans. Okay. So, sexual responses are your physical, emotional, and chemical changes that happen when a person is aroused during sexual intercourse, or when he or she participates in a sexually stimulating activities. This would be you being aroused, you being engaging in sexual activities, whether it's with another person or by yourself. Okay, so just some terms that I'd like you to be familiar with. When you say aphrodisiacs, this would be things that could stimulate you sexually. No, some would look at this in terms of food. No, like it would increase your stimulation and your arousal. Like for example, if you're familiar with clams, they're seen as aphrodisiacs. Spicy foods are seen as aphrodisiacs, wherein it stimulates you. No? It increases your sexual drive. Pheromones are scents that are released by your body, wherein, according to scientists, this is what attracts us, no, to other people. So this would be a smell, no, or an odor that a person or an animal would release that could attract him or herself to another person. Orgasm would be your peak of arousal, no, or sexual arousal, wherein you experience euphoria or excitement. No? Physically, this is when you engage in sexual acts, no? Whether you have sex with the person or whether you engage in masturbatory practices. No? So just to give you an idea of how orgasm works for males and females, no? We have different stages. First would be your excitement. No? This is when you get aroused, when you get stimulated. For males, this is when their penis erects. No? For women, sometimes their nipples would harden. So that's the excitement phase. For the plateau phase, no, this is when they're able to maintain that excitation. Once the person gets to the peak, that's what we call orgasm. For males, what happens is that they ejaculate, no, they release their sperm, and afterwards, there's what we call resolution. For males, what happens is that after they release their sperm, their penis would now retract, or the blood from their penis would now go lessen. So their penis would now relax. And sometimes physiologically they feel tired or they feel sleepy. That's the resolution phase. So often, males could only experience one orgasm at a time. In contrast with females, they have what we call the plateau stage, wherein after they experience orgasm, they may return to the plateau stage for a meantime, and once they continue, they could again experience orgasm and so on until they go through the resolution phase. That's why for females, we have what we call multiple orgasms. Okay, because after they experience one, they may return to plateau stage before uh, what they call this, after, when they return to the plateau stage, they may experience another one before they go to the resolution of their orgasm. They may also have a resolution without any orgasm, wherein simply put, they do not experience any orgasm. They get excited, they get aroused, but they just stay at the plateau stage. But they do not experience any orgasm. So that's what we call resolution without orgasm. Now, love and attraction. Plainly put, attraction is short-lived, while love is a strong or intense feeling of affection to an individual which is usually attached with a strong emotional feeling. So attraction is short-lived because it's just a physical attraction. If you heard of the saying love at first sight, it's actually attraction at first sight because you just see the person for his or her physical appearance and you like what you saw. But love, on the other hand, would be your strong or intense feeling of affection. This is now when you get to know the person better. Okay, so attraction is the one that makes you look, no, the physical appearance and whatnot, makes you look at the person. It gets your attention. It attracts you. But the personality, the kind of person that he or she is the one that makes you stay. That's what we call love. So here we have the triangular theory of love, wherein we have intimacy, passion, and commitment. So there are different combinations of the two. So okay, when we say intimacy, you like the person, you are comfortable with the person. When you say passion, this would be your infatuation. Combining the two, you have what we call romantic love. This would be your flings. Okay, this would be passion plus intimacy. This would be your sexual attraction towards the person. Intimacy plus commitment, no, would be your companionate love. Okay, this is how you see your friends. There's no sexual or physical attraction. That's companionate. You see the person as your friends. Infatuation, or I mean passion plus commitment, would be your fatuous love, passion without commitment. This would be your type of relationship that happens so fast. Like for example, just after a few months of knowing each other, papakasal na or magko-commit na, but then later on, mawawala din. No? So fatuous love usually doesn't work. Now, ideally, we want to have a combination of the three. This is what we call consummate love, wherein you have intimacy, you have passion, and you commit to your partner. Okay. Now, aside from the theory of love, okay, so the theory of love, by the way, is proposed by a psychologist named Robert Sternberg, who attempted to explain the theory or the types of love. Okay, so he attempted to explain and propose his theory about the different kinds of love and identified three components. First would be your intimacy, feelings of closeness or attachment to a person. That's your intimacy, you being comfortable, you being close with the person. Passion, on the other hand, would be your depth, fiery feeling of attractedness, which can be sexual or romantic attraction. That's why it's passion. Commitment or decision is the combination of intimacy and passion, which can cover commitment that is either for a long-term or short-term basis. No? It's commitment because you're deciding to stay with the person. It's your decision. It's you committing to the person to stay with him or with her. Okay. So aside from the triangle theory of love by Sternberg, we also have the 5 different love languages. No? So for romantic, familiar, friendship, professional, and community relationships. So our love language may be our means to communicate how we love a person. It could also be a means to show affection towards ourselves. Okay, so love language may apply to any form of relationship to show understanding, appreciation, gratitude, or recognition. You may communicate it to others, not show your love to others, but at the same time, you could also show your love to yourself. No? We have the words of affirmations. This is utilizing words to show your love or your affection towards another person. Like for example, if you appreciate the person, you tell them directly. Quality time would be bonding, no? Spending time with each others. Acts of service would be you doing things for your loved one, like helping them, cooking for them. Gifts would be your materialistic way of showing your love, wherein you give gifts to the person. It doesn't have to be expensive, but sometimes even the little things. It's you showing that you remember the person or that you've thought of the person and that you want to give them something. And physical touch would be you holding hands, no, being intimate with each other, hugging. So this would be your physical touch. This would be the 5 love languages. Now we talk about STDs. Now, a while ago, when we talk about contraceptives or contraceptions, there are some issues. No? But when you say contraceptives, or rather with the use of contraceptions, it helps us fight STDs. Okay. Nowadays, information is easily accessible and available to all adolescents during the crucial time of development, and being aware of their sexuality may access information that may disorient their perceptions of love or sex. No? So dami-dami na information out there with regards to sex, to STDs, and the like, we might be overwhelmed. No? And we might have a misperception of what sex is and the various sexually transmitted infections or diseases. So these are just some, no, gonorrhea, chlamydia, trichomonas. No? So these would be bacteria that you obtain through, which is sexually transmitted, either oral, no, or sexual. No? HIV and AIDS, this would be a virus that you obtained through sexual intercourse, wherein your immune system, especially when you uh, have AIDS, no? So HIV may transform into AIDS if left untreated. Both of these diseases are uncurable. Okay, so what happens to your body is that you get your immune system lowers or weakens, which makes you vulnerable to a lot of diseases. Hepatitis would be your inflammation of your liver. Herpes, syphilis would be some of the skin problems that occurs because of a virus that is transmitted sexually. No, so these would be visible through your skin, okay. Especially when you're stressed. No, you would have these episodes or attacks wherein your skin would have visible marks that are signs of the following. Okay. Others would be pain in urination. No? You may have UTI. Some may experience pain with sex. No? Others would have what we call discharge from the genitals or tulo in Tagalog. So there is an increasing number of teenage mothers, okay, and especially now during the pandemic, it's been said that there would be a lot of newborns because of the lockdown. So, in conclusion, men and women are sexual beings endowed with the need to love and be loved. Our sexuality is one factor that contributes to our identity, so let us protect our body, emotion, and sexuality. That ends today's discussion. I hope that you had a better understanding of your sexuality, your gender, and overall your sexual self.